Hello, how are you doing today? Welcome back. If you noticed, I missed another one again yesterday. I just wanted to take a break. I'm going to try and do these every day, but I may not always be able to have the wherewithal to do that. So today is day 23. Continuing on talking about depression. I've titled this one "Clinical Depression," and for the rest of us, your comprehensive guide to major, excuse me, major clinical depression. And so this is part two of talking about depression. Major Depressive Disorder, or MDD, is also known as major depression, and it's a mental health condition which is characterized by feeling persistently sad, hopeless, and a lack of interest or pleasure in daily activities that one would expect or things that you used to enjoy doing. It's a prevalent mental disorder, and it can greatly affect someone's functioning and their happiness. MDD, for major depressive disorder, is not simply feeling down or going through a rough time. It's a serious and intricate illness, and it necessitates professional assistance for accurate diagnosis and treatment. So welcome to day 23. If you like these videos and articles, please subscribe to the channel or consider subscribing, and to the newsletter. Leave a comment with any feedback or suggestions, and I'll do my best to accommodate them. So again, this article, we're going to look at major depressive disorder. I already characterized what that's defined by. And it can really mess with work, life, home, sleep, eat, every aspect that you can possibly think of with your life. The DSM-5, which is the manual used by psychiatrists for the Diagnostical Statistical Manual Edition 5, that classifies major depression as clinical depression, also known as major depressive disorder. And a diagnosis of a major depressive disorder means that the person has experienced feelings of sadness, low mood, worthlessness on most days for a minimum of 2 weeks. And other symptoms include, as I said, problems with sleeping, lack of interest in things that you used to enjoy, changes in your appetite, and major depression has various other names in some historical contexts. Some of the alternate names that have been used to describe the condition are clinical depression, emphasizing the severity of the major depressive disorder, and it distinguishes it from normal mood fluctuations or temporary emotional responses to changes in life. Unipolar disorder. Unipolar depression is a term used to distinguish it from bipolar disorder, which includes mania or hypermania and depressed episodes. Then there's endogenous depression. Historically, this term was used to refer to depressions that appear to originate from within the person due to internal factors rather than as a response to an external event, and that distinction is now considered to be outdated. Then there's melancholia or melancholy. Depression was another term. It's an old term for severe depression, and it includes deep sadness, losing interest in things that you used to enjoy again. And it's a subtype of major depressive disorder. The DSM uses features like adonia and early morning awakenings to distinguish melancholia. Then there's reactive depression. Again, that's an outdated term referring to depression that results from an external event or a circumstance, as opposed to endogenous depression. The neurotic depression, another outdated term used to describe milder forms of depression. Non-melancholic depression, referring to a type of depression that doesn't exhibit the typical features of melancholy depression, again, both outdated. Recurrent depression refers to experiencing multiple episodes of depression, although associated with major depressive disorder. Each term has its nuances and historical significance. There are certain meanings and connotations that can vary in different contexts. To diagnose any mental health condition accurately, should always consult with a mental health professional and rely on standardized criteria like the DSM-5 or ICD. Excuse me. Major depressive disorder is a common mental health condition, again marked by persistent sadness and a lack of interest in activities that affects most areas of your life. It's also known as clinical depression. It's a severe mood disorder. It impacts millions of people worldwide, and it's marked by its ongoing sadness and lack of enjoyment and things like that. Someone with depression might struggle to do daily tasks or see a decline in the quality of life. Even getting out of bed can be very difficult, brushing your teeth, hygiene, just really getting through the day. When you're majorly depressed, even breathing in and out can seem like a very hard thing to do. It's like a lot of effort to get through the next minute. Excuse me. Is major depressive disorder the same as depression? Major depressive disorder is a specific type of depression, and its terms are used interchangeably, but major depressive disorder has got distinct symptoms that differentiate it from other types of depression, with a persistent sadness and a loss of interest, among other things, the appetite changes and stuff like that. Whereas clinical depression, characterized again by sadness, emptiness, and lack of interest in things, but it lasts longer than a normal sadness and affects the functioning. Some people use clinical depression as it's classed as major depressive disorder, but they do have their own connotations. Clinical being they use it to emphasize the severity of it. It's one of the things. And this might go back and forth a little bit and jump around. I hope that's okay, and I'll maybe share some of my own stuff as well. Seeing a low energy, concentration, feeling worthless, with clinical depression, thoughts of self-harm, suicide, seeking help, because it's very important and it can be treated with understanding. And there's lots of treatments there. Some of the features of major depressive disorder, as I said, is a lack of interest. I'll talk a little bit about my own depression for a moment. I've had different diagnoses of the severity of depression over the years, and it's been extremely difficult finding treatment that's worked for me. I've tried just about every kind of medication that's available for depression: cognitive behavioral therapy, dialectical behavioral therapy, EMDR, which is for rapid eye movement desensitization treatment. I've had many rounds of ECT, which is electroconvulsive therapy, electric shock treatment. And how they do that is it's not like you would imagine. The old way of doing it, people think of the movie One Flew Over the Cuckoo's Nest with Jack Nicholson, and they actually sedate you, give you muscle relaxers, and you're unconscious for it. And the muscle relaxers stop you from breaking bones and limbs, because it actually, what the ECT does is it induces a seizure, and it's the seizure. There's something about having that seizure that has a therapeutic effect. So I've had that a few times. I've had transcranial magnetic stimulation, where they use a big electromagnetic machine and send magnetic pulses through the brain. I've done that a couple of times, and I've had some couple of courses of ketamine therapy as well, and I'm exploring other treatments. It really is, it's tough, and you get down on yourself for feeling down. But anyway, I digress. Again, some of the signs and symptoms. Depression is very complex. You've got your decreased mood, a lack of interest. There could be significant weight loss or weight gain, insomnia or hypersomnia, fatigue, energy loss, feelings of worthlessness, guilt, difficulty thinking, difficulty concentrating, thoughts of death or suicide. That's something I've fought with and struggled with. Talk about that at a different time. And depression can lead to self-harm, and as I said, in severe cases, suicide. It is important to seek professional help if you or someone shows signs of depression. And over on the website, there'll be an article that goes with this. I'm going to put lots of links, a lot of good resources. So please be sure to check out the article that goes with this. It'll be over on gregscloud.com. And I'll post that a little bit later today. There'll be a lot of really good links in there to some really good resources. And a lot of these are questions that I'm answering that people have brought up. Major depressive episode. A major depressive episode is characterized as having an intense sadness, despair, lasting for weeks or even months at a time. That's characterized again by feelings of hopelessness, loss of interest in activities, appetite changes, difficulty sleeping, problems with concentration, thoughts of self-harm. It can be extremely debilitating, and it affects all aspects of your life, including relationships, work, your overall well-being. And it's essential for people with a major depressed episode to seek help from somebody. How is major depression diagnosed? It involves evaluating criteria set by mental health experts and using the DSM-5 that provides the criteria, and that could include experiencing 5 or more specific symptoms for at least 2 weeks, with at least one symptom being a depressed mood and lack of interest. And to look at your history, how you've been doing. There's some rating scales, ask questions a couple of different ways. Maybe if it's a child's school report, teachers, if if you're in a relationship, maybe your partner might kind of give some input on stuff like that. And the questionnaires and interviews gather information about different symptoms and how severe and for how long, and that can assist in the diagnosis. But it's very much a self-reported thing. How is major depression treated? Usually would involve treatments with medication, therapy, lifestyle changes, antidepressants, and cognitive behavioral therapy are the two most commonly used together treatments for depression. Antidepressants can regulate brain chemicals and improve the mood, and cognitive behavioral therapy, or CBT, that can help people change negative thought patterns and develop healthier coping mechanisms. Excuse me one moment. They refer a lot to, in CBT, reframing, taking a situation and looking at it from a different perspective. And then the stress management techniques, engaging in things like deep breathing, meditation, yoga, different activities that can promote relaxation or reduce stress, and they can assist with managing symptoms, calming the mind and the body. Regular exercise positively impacts mental health by boosting your mood. It increases feel-good chemicals, endorphins, can reduce anxiety and stress and give you improve your overall well-being. They say, whoever they is, but they say aim for around 30 minutes a day of moderate intense exercise. Try and live a healthy lifestyle, of course. To manage major depression, it is important to prioritize a balanced diet and quality of sleep, and avoiding harmful substances. I've had a problem with substance abuse, inhalant abuse. I'll talk about that in a separate thing. Hopefully I remember this stuff right. And it is important to take care of your physical health. Major depression and lifestyle changes, self-care. Major depression affects millions of people around the world. Besides help from mental health professionals, there's some lifestyle changes and practices that can support your recovery. Some areas that they recommend focusing on are the healthy habits and activities that improve your well-being, physical exercise, which can release feelings of depression with the releasing of the endorphins, improving your sleep, boosting the quality of your overall mood by a good night's sleep. They have a saying, HALT, H-A-L-T, hungry, angry, lonely, tired. Mental health conditions are always made worse when you're hungry, if you've not been eating. If you're angry, you get upset. If you're feeling lonely and you're tired, it's a very simple saying, but it is true. Balanced diet, eating lots of fruits and vegetables, whole grains, lean proteins, is good for brain health, which can improve mood and energy. Adequate sleep. Sleep hygiene is a whole subject on its own, and that really can make a positive impact on your mental health. Having a consistent schedule, so going to bed at the same time every night, getting up at the same time every day, including weekends, give or take. Keeping the bedroom just for sex or for sleep. Try not to use your phone in there or have a TV, are all good sleep hygiene things that they advise. To deal with stress and reduce depression symptoms, some people like to try meditating, practicing mindfulness. Coloring could be good, any arts and crafts. Medications for major depression. Different medications treat different symptoms. SSRIs, selective serotonin reuptake inhibitors, are commonly prescribed, and they will increase serotonin levels, which improves mood. And SNRIs increase serotonin and norepinephrine levels to relieve symptoms. And then there's tricyclic antidepressants, which are older antidepressants that are both effective. Are effective, but they often have more side effects than a lot of the newer drugs. And then there's MAOIs, or monoxine oxidase inhibitors, and they're prescribed when other antidepressants have failed, and they require dietary restrictions. They can interact with other medications. Therapeutic approaches for depression, as I said, are the CBT, cognitive behavioral therapy. They can help identify negative thought patterns and replace them with healthier ones, help with some coping skills. Interpersonal therapy, or IPT, can improve relationships and enhance social support networks. It explores how interpersonal issues can contribute to depression symptoms. Psychonamic depression addresses unresolved conflicts from the past that contribute to present symptoms, and it provides insight into unconscious thoughts and feelings. And then mindfulness-based cognitive therapy, it combines CBT with mindfulness to increase awareness of your thoughts and emotions and develop strategies to cope. Understanding severe depression is highly incapacitating, as we talked about. Does require thorough attention and treatment. And although there are therapeutic options out there to help people, the effectiveness varies from person to person. What causes depression? The cause of major depression isn't fully understood, but genetic, environmental, and psychological factors are believed to all play a role. There's some common risk factors. If there's a family history of depression, you could be more at risk of developing depression or being affected by depression. Traumatic life events or chronic stress. A lot of people get depressed after a breakup or a divorce is a big common one. But in the case of prepartum and postnatal depression, Again, it's like a response to a stressful life event. There can be imbalances of chemicals, neurotransmitters within the brain. Chronic medical conditions play a role, substance abuse, history. Various factors cause depression, and it's important to consider both internal and external influences when trying to understand the origins of the depression. Excuse me. Major depression risk factors. Depression affects everyone regardless of their age, gender, or background. As I said, certain factors such as genetics can predispose you. Trauma, stress, medical conditions, substance abuse, brain chemicals. Those factors don't guarantee depression, but they can certainly make you more susceptible to that. How would you supporting someone with depression or getting support for depression? Supporting someone with major depression starts by understanding their symptoms. Major depression is a serious illness. We talked about the symptoms, feeling of sadness and aloneness, feeling guilty for feeling guilty. Just trying to be a friend, let them know that you're there, that you care, that you love them. You can even say, look, I don't know how I can help, but I want you to know that I care. Communication and emotional support, maintaining open communication and support's crucial. Try and encourage someone that you love that might be struggling with depression to try and express how they feel. Assure them, you're not judging them, and listen, really listen. You got two ears and one mouth. Maybe a reason for that design. So assure them that you're not judging, and really listen to hear. Be patient, be empathetic, try and be understanding as much as you can be, and encourage them to seek professional help if you think that that's needed. Try and educate yourself a little bit about depression and what treatments might be out there for them. They may not, they may be confused by the depression. Building a support network, understanding people can really help you. So staying socially connected, along with professional help, and the lifestyle changes can make a difference. Seeing a therapist or a counselor can help. They provide strategies to help you cope, medication when needed. The self-help resources like books and articles, apps, podcasts that you can get some help from. And seeking help is not a bad thing. It's okay to seek help. It doesn't mean that you failed or anything like that. And then a little bit about prevention. Preventing and management is crucial. One of the strategies, besides adopting a healthy lifestyle, is to try and get a relapse prevention plan and strategies to help you cope. So when you're not feeling down, write some things down that you could maybe do. Write some numbers. Maybe even say to some people, look, if I'm really struggling, can I call you if I need some help? And write those numbers down on a piece of paper. Because when you get to be in a depression, you're not going to remember them, and the phone's going to weigh 500 pounds. So determining self-care and support, very important. Try and build resilience with your support system. Seeking therapy, self-care, support groups, healthy relationships, good boundaries, knowing what a friend is and what a friend is not. Setting realistic goals, breaking large goals down into smaller steps, continuing treatment, staying committed to your treatment plan, including therapy, medication if that's prescribed. Try and identify things that might be a trigger and pay attention to those situations or events that might trigger a depressed feeling. Try and build resilience, strategies to handle setbacks and stuff. Breathing really does help. Sometimes just closing your eyes and just slowing down the breathing. It releases the muscles and stops you clenching. You can get really het up and all your muscles and everything clam up, and your teeth and just that breathing can just it can really help a lot. Trust me, it really does. Cultivating supportive relationships. Know who your friends really are, who you trust, who you can't trust. That means within your family as well. You may not, it's difficult to find somebody that you can really confide in, but it's okay to have different levels of friendship, and you don't have to tell every person everything. Doing some of those things can, help aid you in your recovery. So yeah, and then professional help when that's needed. I've certainly had to seek that. I've been hospitalized a few times and stuff like that. Expert guidance. There's peer-led support groups. There's you know, just look for resources, and I'm going to share a lot of those on the website. So just to kind of wrap this up, because I'm starting to wander off a little bit. Let me. My mouth is getting dry. One moment, please. I'll wrap this up a bit, and then I'll try and answer some more questions. Major depression is a very serious mental illness requiring early diagnosis and professional assistance. Ignoring those symptoms can have serious consequences on all areas of your life. Treatment is essential for healing, with options such as therapy, medication, and lifestyle changes. So some questions. Is major depressive disorder, is depression a disability? Yes, depression is a disability. It comes under the Protection of Americans with Disability Act, the ADA, which safeguards people with mental health conditions such as major depression against discrimination in the workplace. And you can learn more about that on the ADA website. There'll be a link on the article that goes with this, which will be posted shortly on gregscloud.com. What causes major depression? Several causes are thought to contribute to it, very diverse. Could include biological, genetic, environmental, psychological, imbalances in brain chemicals, a family history of depression, stressful events, history of trauma or abuse, some personality traits and coping mechanisms, or maladapted coping mechanisms, unhealthy coping mechanisms, could all contribute to causing depression. So a combination of factors. How's it diagnosed? It's diagnosed by evaluating the symptoms and taking a medical history, a psychiatric assessment by a trained professional. The DSM-5 is used to determine if someone meets certain criteria of symptoms like persistent sadness, loss of interest, appetite changes, sleep disturbances, fatigue, worthlessness, guilt, or difficulty concentrating, thoughts of death or suicide. All those things are considered when doing a diagnosis. Excuse me, Alexa, stop. This is the brain injury thing. I have to set these reminders, and they're a pain in the backside sometimes. Okay, physical exams and lab tests might be done to rule out other medical conditions and help with an accurate diagnosis. Getting an accurate diagnosis is very important because that's going to affect treatment planning. What are the available options for major depression? Medications such as SSRIs, SNRIs, TCAs, your tricyclics, and therapies, CBT, IBT, ECT, electroconvulsive therapy. Sometimes that's used as a last resort, but it certainly has a place. A combination of medication and therapy, often recommended, and it's very individualized. How long does it take to recover from major depression? I don't know. I'd like to know that myself. Recovery time depends on how severe the depression is, the actual person, the circumstances, type of treatment, type of depression. Some people might see an improvement within weeks or months, and others might take longer. And some people, like myself, have treatment resistant depression, which will be another video, an article, because treatment resistant depression deserves its own specific attention. Recovery is unique from person to person. Don't be discouraged if you're not seeing relief from your symptoms. Doesn't mean that you'll never get better. There's always other options out there. Seek professional help for an accurate assessment and a personalized plan. Can depression come back again, or can it recur? Yeah, it can happen multiple times. People with major depression episodes are likely to experience it again. But again, don't give up hope. It doesn't mean it's going to be forever, or there isn't a treatment option for you, or a combination. Factors like genetics, stress, personal circumstances all influence whether it comes back again. Proper treatment being important. How do clinical trials play a part in treating major depression? Clinical trials are crucial in treating major depressive disorder. They evaluate new drug treatments and interventions. They provide insights into the safety and the effectiveness of new treatments. And clinical trials help identify optimal dosage, methods of administration of medications, duration of treatments, and they help contribute to evidence-based medicine and can lead to breakthroughs. Depression screening is crucial to identify individuals with symptoms of this mental health condition. Healthcare professionals use various assessment tools and questionnaires to gather information about how someone's doing and determine if further evaluation excuse me, or treatment's needed. And screenings occur in healthcare settings, typically always by trained medical personnel. And the goal is early detection and interventions. Resources, I'm going to put a lot of, it's really hard to talk about these because mostly links. But here's some things that are going to be in the article with links over on the website to these. There's depression clinical trials. There's a couple of different websites I've got on here. One is government website, which is one is Center Watch, that maintains a list of clinical trials. I'll put that over on the website. Clinicaltrials.gov is another one. National Institute of Mental Health is another one. All these links will be over on the website. Find Me a Cure is another one. And then there's a website called PsyQ, which bills itself as the world's largest community of online resources for mental health. Put a link to that over on the website. I'm going to put a link to Emotions Anonymous. It's just one of many anonymous type groups which can be helpful. You've got NAMI, the National Alliance on Mental Health. They offer support and resources for people and their families affected by mental illness. They've got lots of listings of support groups, help phone numbers. They can provide assistance and information. It's a valuable resource. A link to that over on the website. Then there's Mental Health America. If you've got mental health, affected by mental health, personally, or know someone affected by mental health, there's a lot of information over on Mental Health America. You can find a warm line. Talked about that the other day. That's it's if you're feeling kind of down, you just need someone to talk to, but you're not suicidal. They have these things called warm lines you can call. Link to that over on the website. Substance Abuse and Mental Health Services Administration, or SAMHSA for short. It's part of the US Department of Health and Human Services, and that works to improve mental health and substance abuse services in the country. Link to them over on the website. They've got a lot of resources. Psychology Today maintains a directory of support groups that you can find by your state. Meetup builds yourself as a people platform. It's got an online directory of different support groups, as well as, you know, things that you're interested in. Great place to find a new hobby or hook up with like-minded people. There's a website called 7 Cups, and that offers a service where you can be heard or speak to a volunteer or a listener, trained listener, chat with other people who understand in different support rooms. And you can also sign up to be trained as a listener, and you can help support somebody else. A link to that over on the website. Daily Strength is another online support community. Then there's Suicide and Crisis Lifeline. If you're in mental crisis, dial 988, and Suicide and Crisis Lifeline can help prevent suicide. Someone's there 24 hours a day to offer free and confidential support for people in distress, prevention in a crisis. Also resources available for you or your loved one. So there's a link to that over on the website. Covenant, excuse me, Covenant House 9 line is a USA teen line for youth and parents. Offers shelter referrals, crisis intervention, and health clinic referrals throughout the US. Bilingual, it's free. Link to that on the website. The National Directory of Mental Health Treatment Facilities is a compilation of state and government facilities as well as private facilities that offer mental health services. Link to that on the website. If you're in the UK, there's an organization called the Samaritans. A link to that on the website with a number. And there's also international suicide hotlines. I'm going to put a link to that on the website. They maintain a list of international suicide helplines if someone's in immediate danger. Again, if you're in the USA, call 911 if it's life and death situation that you feel that you're in. Otherwise, you can call 988. So yeah, I hope that you enjoyed today's content. If you're new here, I'm glad that you stopped by. You know, it's not easy creating when you've got several health challenges. What am I thankful for today? Well, today I'm thankful for, excuse me, I'm thankful for social media. It allows me to stay in touch and make new friends. Additionally, it allows me to discuss mental health and emphasizes the and to be able to emphasize the importance of kindness. What are you grateful for today? Let me know in the comments what you're grateful for today. Let me know any topics that you'd like to see me maybe discuss or talk about. As always, thank you for watching. I love you all. I hope that you enjoyed this. I'll see you next time. And remember, take care of your mind. Bye.